Well, welcome to all of you to our beautiful desert oasis. This is a panel and discussion about local communities. We all love our desert home. We're surrounded by magnificent mountains, blessed with abundant natural resources, and year-round sunshine. Here, even when it rains, it's a dry rain. The desert is ground zero for the development of renewable energy in solar and wind and geothermal. We're rich in agriculture too, and yet, as you heard from Chelsea Clinton earlier today, we're in the midst of a food desert. People flock here for our weather, our recreational opportunities, golf, hiking, tennis, world-class art and culture, and with all that, we're still, at our heart, a small local community, a distinct advantage when it comes to trying to make change. We're truly a land here in our desert of extremes. Our highs are high. Mount San Jacinto, second highest mountain in Southern California, where you climb 10,000 feet in just 7 miles, the steepest escarpment in North America. And our lows are low. We're home to the Salton Sea, the largest lake in California at 378 square miles and 227 feet below sea level. Our 9 cities rank among both the highest and the lowest in per capita income. And with these extremes come challenges, including significant health challenges and disparities, healthcare access issues, and health problems due to high levels of overweight and obesity. You'll be hearing more about the specifics of these challenges, problems, and some community-based solutions in just a few minutes. Our healthcare district and our nonprofit foundation started working in our local school district more than 4 years ago when we commissioned a major study on childhood obesity to find out the levels of seriousness in our neighborhood. In our community at that time, nearly 1 in every 3 students in grades 5, 7, and 9 were either overweight or obese. In some schools, more than half of all students were overweight. In grade 9, the data were more significant. In the last decade, we found the levels had risen more than 60% in 10 years. Clearly, the realization that we were raising a generation of XL children, and our kids were becoming the first generation that might not live as long as their parents, spurred us into action at the local level. Schools, we know, are powerful places to shape health and well-being for students, staff, and families. Yet many don't have the financial or technical resources to build healthier learning environments. We began working in partnership with our local schools to fund nutrition education, breakfast programs, looking at strategies to reduce the levels of overweight and obesity to make the school environment healthier. We started a 3-year project in Palm Springs with 4 schools, 1 a charter school. Then, last year, like many of you, we came to the Health Matters Conference and were introduced to the Alliance for a Healthier Generation and the programs and the evaluation and the techniques and tools that they brought to the table. We were impressed. We asked ourselves, what if we broadened our reach from 1 school district, 4 schools, and we instead turned to our entire Coachella Valley, 3 school districts, 92 schools, 71,000 students, all at once. We asked the Alliance for a Healthier Generation if they'd partner with us to try and make that happen. And here we are a year later. We did. Our funding, our Desert Healthcare District and Foundation funding, supports a full-time Healthy Schools Relationship Manager for the Coachella Valley. And over the course of the next 4 years, the programs will be instituted and implemented in every school for every student throughout the Coachella Valley. This is the first time that this opportunity for the Alliance to address every school within a confined, specific geographic region has been put to the test. But in a very short period of time, less than a year, we're well on our way. Today, every school board in our valley has already signed on and committed to make important policy changes and implement the program. Every school has agreed to develop a wellness council and engage students, faculty, and parents in making positive and lasting change to instill a healthy environment and healthy behaviors in our kids, in our schools, in our homes. And we're measuring results, importantly. We're so grateful to President Clinton, to the Clinton Foundation, the Alliance for a Healthier Generation, and the Health Matters Initiative for providing the inspiration and support to take action. That is our pledge, to put the Alliance program in every school, in every district, all schools, every student throughout our valley, and to work together with our partners to make behavior change, to make policy change, and to make system change that will reduce the number of overweight and obese children and families in our valley and the associated health problems that come with it. Together, we'll move the needle in a positive and healthy direction toward wellness, and we're pleased and proud today to pledge our continuing support to make the desert ground zero for activating wellness in every generation. We are all in. Thank you.